And item 8 then is the drugs and alcohol update. Yeah.
Yeah, so this is a new report, Commissioner. So obviously I'll take feedback probably after the meeting around the style or the content, but it's a new report that tries to cover a little bit of everything, really, dare I say. But it particularly looks at our response with partners in relation to looking at drug and alcohol misuse. If I can just take you, with it being a new report, if I can just take you to paragraph 4 of the report, which talks about two main categories, if I can. One's in relation to possession of the drug, or possession of the alcohol whilst driving, for example, and one is around criminal offences that are fuelled by alcohol or drugs, because I think they're quite distinctive, really. So that's just covered off in paragraph 4, and I think it's important to look at that. As we go through the report, I was certainly quite alarmed at the number of people that we interact with and arrest and come into our custody who are either drunk or in drink or affected by drugs when they come into our custody, or alternatively who tell us that they've consumed alcohol prior to arrest. And those figures are just in paragraph 7, and whilst they show a slight upward trend depending on how you read them, actually it's still quite a lot. So 33% in January, 33% of the people we are dealing with talked about having consumed alcohol. So one in every 3 prior to being arrested, which I think is quite a high number, and something which I've asked for some further work to be done moving forwards, because that does impact as to how quickly we can deal with these people in custody, how much medical assistance we've got to give them, and a real drain on our resources and backing up in custody if people have come into custody and we can't effectively deal with them. So I'm just keen to sort of highlight that, if I can, please.
Is it fair to say, Angela, that doesn't mean to say that they have been drunk? It's just that they have consumed some alcohol, so it will vary.
It will, but it shows how things back up. So when I get quite frustrated around, say, Elland Road custody, around the throughput and how quickly we can process someone, and we have to deal with them expeditiously as per the law, as per pace, that might just give us an indication. Yeah. I think as well, it's really important to look at paragraph 8 of the report, and that gives you a real flavour of the scale of the problem. And we can see when the people arrested in January 16, 24% said they were alcohol or drug dependent, so 1 in every 4. But actually in January 17, 27% said they were alcohol or drug dependent, which is a huge drain not on only the police but the wider partnership and health as well. I'm not surprised by that figure, but when it does jump off the page, and it's something that we found when we've been looking at the new contract for Leeds Community Healthcare Trust when that finally goes out to tender. So I think it's just important to point that out. The report talks about the DIP programme, and as we know that goes back sometime to 2003, around when we started to look at our drugs intervention programme, and the funding came along for the detention officers then to be able to drug test our people that came through custody. And it talks also around, that's a really good opportunity for us, because that might be the detainee's first contact into the criminal justice system, and it's not an opportunity we want to miss in relation to getting in early with them. The report also talks about paragraph 13 around how we would drug test people. These are people that are 18 or older when they come in for a trigger offence, so such as burglary or acquisitive crime or shoplifting, but alternatively when we would test them for the inspector would authorise this, and that is when there's reasonable grounds to suspect that Class A has contributed to the offence. And we're having far more of those tests now in relation to, say, domestic abuse offenders, where it's not a trigger offence, but actually the inspector would authorise us to go ahead because drugs have played a part in their offending. And that's work in progress, because we changed that in line with our IOM processes last year, if you recall, after the pilot at Wakefield that was very successful. The report talks about then what would happen if somebody tests positive in relation to a drug test, around them having an extra appointment with intervention staff and then being able to access some support with DIP. and then obviously the requirements that they've got to adhere to, and also then the arrest referral workers, which are linked into our custody suites. So it's around trying to break that cycle of that revolving door, trying to get in early when somebody is arrested who has a drugs or alcohol problem, who we've tested, trying to deal and support that person moving forward. At paragraph 18, it talks a little bit around that we did have Leeds Community Healthcare Trust doing some work with us, with the community intervention team, but now that's moved on somewhat, and we've had the very successful liaison and diversion project that's worked in Wakefield and is soon to start in Leeds, around those people coming through into our custody with those very complex needs, which is affecting their behaviour and affecting victims moving forward. And I know at the meeting last week at the Partnership Engagement Group, this was talked about around this cycle and trying to support people to break the cycle. And then obviously the report talks about risk assessments as well, around us trying to find out how the person is when they're leaving our custody and not missing that sort of last opportunity. In relation to preventative actions, as you're already aware, we have our IOM programme, our Intervented Offender Management programme, and at one point we just used to look at serious acquisitive crime offenders on that particular programme. Now we've fleshed it out somewhat to look at risk of harm, so again the wider vulnerability issues of domestic abuse and CFE offenders, and we've got around 1,000 people on our IOM cohort at the minute across the 5 districts. The report then talks on a little bit around our mental health and how we are working with mental health practitioners, and I know we have had some funding for nurses in some of our control rooms, which has been very successful indeed. And you spoke only last week at the PEG, at the Partnership Executive Group, around the Leeds nurse, obviously in Leeds control room there. And then the report finally talks about other options and other tools that our neighbourhood teams have got. So the DPPOs, I know we've had a number of successful ones in Leeds and Bradford, and this is around drinking alcohol in public places and allowing our staff to be able to seize the alcohol. And we are looking at other ASB powers to be able to deal with alcohol out on the streets moving forward. And that's the report. It does cover, certainly when I've looked at the report and tasked the report out, it does cover a lot of areas. But as I say, it's the first version of this report, and we can certainly take it into a specific area if you wanted within the custody suite or the IOM or linked back to health that moving forwards. It is a bit of a catch-all, I feel, but actually I think what it shows is that drugs and alcohol is very much alive and kicking in our people that come into custody, which is a concern.
Thank you, yeah. And as you know, I did commission a review of the drugs intervention programme.
Yes.
It's about 3 years ago now. But following that review, we did try and widen the definitions of all drugs and alcohol misuse. And I accept that some of this is about the timing of commissioning
Yes.
of services in each of the districts. So hopefully we're in a better place to understand when that is taking place. And again, 34 projects have been funded through the Safe Communities Fund, totalling more than £130,000 in the area of tackling drug and alcohol misuse. You're right that some of the figures are quite stark. You referred to the 27% of arrests in January of this year, saying that they were either alcohol or drug dependent, which is, a real eye opener and a worry. On page 2, the focus of the drug intervention programme was on Class A drug using offenders,
Yes.
particularly around acquisitive crime, volume crime. How has intervention work in custody responded to the changing profile of prevalence of alcohol-related crimes and the use of cannabis and psychoactive drugs now termed illegal highs.
Yes, we've done quite a lot of work around the legal highs or the illegal highs and tried to push out to our staff some of the legislation around that. And obviously we've done that in relation to our festivals as well within West Yorkshire. But we have got the opportunity when someone comes into custody, even if they are not drug tested as per the trigger offence or the inspector's offence, still to be able to pathway them. They can still see that the Leeds Community Health Care Trust, because they're our current provider, the nurse, they can still see them, they can still be pathwayed afterwards, given support and numbers to call, websites to go on, etc. And actually what the staff will say is they're a captive audience whilst they're in custody, because they're waiting to be interviewed or to sober up or what have you, so therefore they can sometimes land the message when elsewhere they might not be able to. So I think it's around referrals, it's around signposting, and as I say, we've got the liaison and diversion scheme at Wakefield that will soon be rolled out in Leeds as well, so we're quite excited about that. And we have trialled that on a couple of weekends when we've opened Steinbeck to be able to get Leeds staff used to it.
I do think that this is highlighting, and I think that's one of the benefits of this new report actually, that we have a tremendous number of very vulnerable people coming into custody for a variety of offences that have been fuelled by alcohol or drugs. And it's because of their addiction to either drink or drugs, or indeed on occasions both, that has led to that offending behaviour, when actually there's a vulnerability sitting at the heart of this. So if there's ever an area where we still have some work to do in terms of prevention, early intervention, this one is it, I feel. And at some point we will no doubt have the same debate around these issues as we've just had around mental health and the appropriateness of custody. And no doubt we'll have the same conversations around detoxification centres and so on, as being perhaps something that we could further explore in partnership. But it feels as if the police service pick up, sadly, the outcomes of these addictions rather than trying to prevent them from happening in the first place. Yeah,
and again, as you touched on the joint work, and certainly I've put in some funding to co-fund mental health nurses in both Leeds and Bradford in the police control rooms, and I guess it's to what extent do you feel that these initiatives are assisting and influencing the outcomes?
Well, I think they absolutely are key to delivery moving forwards, but for all the districts, and I understand the funding is different in different places, but they're absolutely key, because actually there is no downtime for these nurses that work in our control rooms. They are getting upstream, they're looking at our systems, they're cross-referencing against their own systems, they're able to advise callers on the telephone and ring callers back, they're able to advise officers who are being dispatched to the scene. The officers would say they're absolutely first class and invaluable, and only last Friday we saw an award given to our Kirklees nursing team around the work they've done, and when you heard the citation, I think it really hit home. They are a really embedded and valuable member of the team because they have the skills that we don't.
Yeah, and just to let you know, I'm trying to progress conversations through the mental health forum in terms of trying to get some consistency of approach across the 5 districts, because as you say, we've got this mix and match. We've got the street triage initiative, we've got liaison and diversion, and we've got mental health nurses in control centres, all playing really good roles, but it's a bit fragmented still in terms of what is mainstream and what isn't mainstream, which is difficult to work through some of these issues with our partners.
I think you're absolutely right to raise it, and I know some of the staff who work, say, at Bradford or Calderdale look at envy in relation to the Beckling Centre at Leeds and how that's staffed when they arrest people under Mental Health Act. So I think you're absolutely right to raise it. We have a little bit, whilst we've got services across the piece, they are different in different places.
Yeah. So that's work in progress. And then while volume crime and public disorder can be attributed at times to the misuse of drugs and alcohol. Do we know what extent that they play in the role of domestic abuse incidents, and can you tell me more about how the police are dealing with that?
Yes, well, at domestic incidents, it's even higher than the traditional crimes and sack offences that I refer to them as. And what it talks about there is in January 17, out of all the arrests for domestic related incidents, 42%, so not far off half, 42% said they'd consumed alcohol recently, and 24% indicated they were drug or alcohol dependent. So actually, alcohol has absolutely played a part in some of that domestic abuse offending, and that's why now we've had the pilot last year in Wakefield, but it has run out to all the other districts now, around the inspector being able to say, you know, we can sort of engage with our detainees and proactively for the Class A test them if drugs have been an issue and part of their offending. So it's absolutely key, but it's an opportunity because some of these people have been arrested and they've never been in custody before, and actually it's an opportunity for us to get upstream with them.
Okay. Yeah, I mean it's pretty shocking statistic, isn't it, that the 42% and
Yes. Of domestic arrests
yeah.
just in January just gone.
Yeah.
And it was 40% January before, so it's still going up steadily.
Yeah. Okay, well I think it is a very useful report in setting out the picture and some of the current issues that we are facing, so thank you for that update.